Hi, my name is Shekinah Moon, and today I'll be talking to you about the Canada and the United States of America healthcare systems. A little bit about Canada. It was founded on July 1st in 1867 and is the second largest country in the world with a population of about 34.88 million people, and the capital is Ottawa. It also has the fourth largest population density in the world with only 3 people living per square kilometer. In Canada, they have a mixture of universal and private insurance. It provides coverage to all Canadians with a few exceptions that all citizens qualify for health insurance regardless of their medical history, personal income, or standard of living. The things that are not included by the government is medication, dental, and eye services. 70% of the insurance is covered by insurance, and they spend less on their gross domestic product. In the United States, they also have a mixture of universal versus private insurance. They spend more on their gross domestic population than Canada, and employers cover the large proportion of the U.S. population. Because of this, they rely mostly on privately funded insurance, which estimates to about 67.5%. They also have 2 options of health care: Medicaid, which is care for low-income families, women who are pregnant, children, elderly, and even people with disabilities. This also covers Medicare, which is care for the elderly, and it consists of 4 different parts. Now, the key difference is that in the United States of America, people have to pay premiums for their health care insurance, whereas in Canada, most of it is covered by the government. All right, so here I have 3 graphs for you. This graph over here to the far left shows Canada's overall highest life expectancy of 84 years old for females and 79 years old for males. In the middle here, we have a comparison of both of them together, and it shows this high life expectancy as well. And then here we have the U.S., and it's saying that the overall life expectancy is 81 years old for females and 76 years old for males. So in Canada, they only spend $6,603.70 per person. Overall, it represents 11.5% of Canada's GPD. It now reaches over 242 billion overall per year. In the graph, we can see how the country's spending amounts differ each year within the years of 2001 to 2010. The graph also shows the amount spent on healthcare as it exponentially grows over the years. Each amount has more than doubled from 2010 to the present day. In the U.S., they spend $9,024 per person, and their spending grew 4.3% since 2016, and it now reaches $3.3 trillion overall per year. In the U.S., the total healthcare spending are the highest in the world due to our healthcare coverage prices being higher and leaving private insurance and medical coverage providers in charge of deciding the prices. So for flu immunizations in Canada, 35.8 per 1,000 people in Canada receive their influenza vaccine, but not enough people in Canada receive their influenza vaccine. 36% among 18-year-olds and older get vaccinated. 37 adults aged 18 to 64 years old with medical conditions get vaccinated. And 69% among seniors aged 65 years or older get vaccinated. From the graph, we can see that all types of age groups have improved immunization rates over the years, but still not enough people get vaccinated because that number should be a lot higher. In the U.S., there are 43.3% per 100,000 U.S. adults that get their vaccine. Their vaccinations have decreased the confirmed cases of influenza from about 2.4% to about 1.1%. The Tdap vaccine is one of the most cost-effective among the adolescent immunizations. From the graph, we can see that the flu rates change was about 31.1 points in the years 2017 to 2018, which decreased from about 6.2% from the previous flu season. From the graph, we can also see that the flu vaccination rates among adults decreased from 1.9 points in the 2015-16 season compared to the 14-15 season. For all vaccines, achieving and maintaining high vaccine coverage is critical to the same process and reducing the impact of vaccine-preventable diseases. As adolescent coverage varies among all the populations based on their race, ethnicity, income, and type of shot. In the 2010 Affordable Care Act, it requires health insurance plans to cover preventative services, including these immunizations, without charging deductibles, co-payments, or co-insurance. %91 per 100,000 children received the Tdap vaccine in 2016, and 89% per 100,000 received the measles vaccine. For children aged 6 months to 4 years old, the overall vaccination rate is 30.9%, which is extremely low. Again, not enough Canadian adults are getting, and children are getting vaccinated. And the vaccination rates for children aged 6 to 23 months was 24%. In the U.S., 94% per 100,000 children received the Tdap vaccine in 2016, and 91% per 100,000 children received the measles vaccine. For the combined 7 series of vaccines, the total rate was 72.2%, as you can see, which is way higher than Canada's. Polio is the highest vaccination rate with 93.7%, and children in Ohio, or in the U.S., have 73.5% children that get vaccinated, and from ages 2 to 4 years old is 66.8%. And the vaccinations in the U.S. have led to a 95 decrease in vaccine-preventable diseases in the past 50 years, with a great progress. So both the Canada and the United States have an air quality agreement that was signed in 1991, and it gives specific regulations. It helps reduce acid rain and other harmful chemicals that may be harmful to humans, animals, and the environment. In December 2000, both the countries agreed to the Ozone Annex Agreement, which agreed for more regulations of acid rain and worked towards ways to improve the environment and air quality for its citizens overall. In the past 10 years, in the United States, air population has decreased 30%. Population levels in many areas of the United States exceed national air quality standards for at least one of 6 common pollutants. Certain communities in the U.S. are disproportionately affected by certain climate change-related impacts, which are associated with increased deaths, illnesses, and economic challenges. These impacts include heat waves, degraded air quality, and extreme weather events. Studies also find that climate changes pose particular threats to health, the well-being of its citizens, and the way of life in people in the U.S. Air pollution in Canadian families is estimated to about $36 billion in 2015, and it also included premature deaths and illnesses. In 2008, the Canadian Medical Association study included about 1,500 people that died prematurely every year because of air pollution. New research in 2015 suggests that the number of premature deaths caused by air pollution is closer to 7,700 people per year, which is a lot less, which means that the air quality in both the United States and Canada is getting a lot better. In Canada, 0% of their people are uninsured. Because they have their own universal health insurance programs, they cover all the citizens. In the U.S., 8.8 per 100,000 American adults under the age of 65 are uninsured. About 8 out of 10 Americans who are looked for insurance in the past year reported that they don't have insurance are because the costs are too high and they just really couldn't afford it. In 2017, 8.8 of people, or 28.5 million people, did not have health insurance at any point of time in the United States during the year. The uninsured rates for non-Hispanic whites is 6.3%. For Hispanics, it's 16.1%. African Americans is 10.6%. Asians being 7.3%, which is the lowest. In the United States, the uninsurance rates has definitely dropped due to the Affordable Care Act being enacted, but 33 million non-elderly Americans in the U.S. still remain uninsured as of 2015. As earlier stated in the presentation, most insurance is provided through employers in the U.S. Due to this, Americans are uninsured because an employer may not provide the insurance, or it may be too expensive, and then also it may not have the right family bundle for everyone included in the family. Overall, those who are uninsured have more health disadvantages, which accounts for an estimated 4,400,000 people excess deaths per year. .2% per 100,000 individuals are unemployed in Canada. In 2017, the unemployment rate in Canada was around 6.33%. Canada's unemployment rate drops to an all-time low of 5.8%, and this is due to the overall job increases in July of this year. The economy has new jobs that were implemented last month and saw its employment rate fall extremely and went down to 3.3 just last month. In the U.S., 4.1 per 100,000 individuals are unemployed. Unemployment rates have dropped 3.7%, which is the lowest it's been in almost 50 years. Some of the key takeaways are that both countries differ in many ways due to the way the healthcare systems are funded and paid for. Canadians live longer than Americans, and the U.S. spends almost double the amount of money on healthcare costs than Canada. Both countries also have a mixture of universal and private insurance. In Canada, it's mostly universal, and the U.S. is mostly private. Both countries have improved their economies by creating more jobs and making strides to improve health with preventative care and access to vaccinations. A higher percentage of Americans receive their flu and childhood vaccinations compared to Canadians. Both countries have improved the environment and achieved better air quality. All Canadians have health insurance, but in the U.S., thousands of people still remain uninsured. Thank you for your time.